Nothing But the Truth. Hello, I'm Raj Chengappa from India Today and your host for Nothing But the Truth. Every week, we will deal with key issues of concern and bring you clarity and perspectives as to why these matter to you and the one clear truth that emerges. I opened my computer and I checked just how many COVID cases were there in India. And to my pleasant surprise, I found that in the month of November, the average number of cases in India was around 955, certainly less than 1,000 a day. Now, when you look back, and if you just scroll that, if you ever get into a computer and look at January 2022, early this year, the average daily cases was 300,000 cases. Now, the good news is that despite the fact that we had almost an open Diwali, let's put it that way, most people were without masks, there were massive gatherings, and the ongoing festive season continues to bring the crowds. There is a marriage season on, and yet the numbers have plateaued and have dropped considerably to less than 1,000. Now, this is in sharp contrast to what we all remember, that when in March 2020 COVID struck us, there was a steep cliff that went up, you saw cases going, and then they started to drop. And we went into a situation of complacency, and by the end of that year, the Delta wave struck. And that was far more devastating because of the kind of ailments that it brought. We all gasped for breath, there was a shortage of oxygen, many people lost their lives during that period. And just as we thought that the Delta wave was on the decline and we were becoming complacent, we found that in late December 2021, early January this year, the Omicron virus began to strike and the third wave began across the country. Now, it in fact spread far more rapidly than others, and I recall that in April this year, I had avoided the first two waves. I actually got COVID, and this was clearly the Omicron virus because it was a very mild attack, and I had a sore throat, I had fever for a day or two, and by the fourth day, I was up and about, and I was able to return to work fairly quickly. Now, just like me, thousands of people were afflicted with Omicron or the third wave of COVID. We think it's Omicron, but they recovered rapidly. And unlike in the first two waves, the death rate was negligible. And more importantly, or as importantly, the hospitalizations that happened during the second and first wave was almost absent during the third wave of COVID. So given the fact that we are almost down to 1,000 cases per day, which any normal flu will have across the country, is it time to say bye-bye or tata to COVID? Can we declare the pandemic over? And have we seen the last of one of the most devastating virus attacks that humankind has faced since the Spanish flu happened 100 years ago? So first, let's look at the total numbers of COVID cases that has afflicted India since the time it began in March 2020. Current estimates put it, if you look at around November 2022, 44 million cases of COVID have happened in India, and over 530,000 people have died because of it. Worldwide, the toll is even higher. It is estimated that over 600 million people across the world were afflicted with COVID, and close to 6.6 million people have died. As of today, there are over 350,000 COVID cases happening every day. But in India, as I had mentioned earlier, it's below 1,000 cases a day. Some countries are seeing a resurgence of it. The United States is one, certain countries in Europe, China too, and Singapore more recently have seen a surge. But in India, the plateau that we've been seeing for the last 9 months has remained, and therefore the question that we can ask in India is that, are we free of COVID? Can we declare the pandemic over? And worldwide, is it also drawing to close? Now, top experts that I spoke to said that the answer is far more nuanced. I interviewed Dr. V.K. Paul, who is the member of the Niti Aayog and who actually oversaw or continues to oversee the entire central government's handling of COVID, particularly the vaccination program. His answer is interesting. He says we cannot say there is a full stop to COVID or even a semicolon. We cannot say that the book is ending. We could say that there is another chapter, but we do not even know whether there is a new chapter that is going to happen, a fourth wave or a fifth wave that could strike India. Even the World Health Organization is clear that the pandemic is not over. Many countries still have the disease and that the world must be cautious. That is something also the central government believes in. It has continued to advise people to wear masks when they go to crowded places, or if they are traveling, particularly by air or by train, to take these precautions. But by and large, the major restrictions that we had during the first 2 or 3 phases of COVID is now completely on its way out. Many experts, like Dr. Gagandeep Kaur, say that because we have not seen a surge of cases in the last 6 months, they feel that the pandemic phase of COVID is almost over in India. Which then comes to the answer to the second big question that we're asking: can we say bye-bye to COVID? Now here again, the answer is very cautious. There is certainly the virus that exists and continues to lurk, given the fact that we have had cases, though as we have, the good news is that it is fairly plateaued out. So while the pandemic may be seemingly over, the fact is that the virus continues to be around in India, though not in the kind of virulence and the kind of intensity and the kind of venom that was there in the earlier phases. And as I said, the good news is that it has plateaued in the last 9 months, and very importantly, we haven't seen the kind of hospitalizations or the deaths that we have seen in the previous waves that we had on COVID. So let's look at why this phenomenon has happened, that though we have COVID still lurking around in the corner, it is not such a major threat to us as it was earlier. The first big reason is this, is that though many of us may not have got COVID, particularly the fact that we are 1.4 billion people, and as I mentioned earlier, we had only 44 million cases being reported, the fact remains is that experts believe that almost all the population was afflicted with the virus, but as statistics showed, almost 80% of the people who got the virus were asymptomatic, which meant that they showed no symptoms of COVID. They must have got the virus, but it did no harm to them. They didn't have fever, didn't have any of the symptoms, and they felt there was no need to test. Now, what that has done is, as Dr. Paul says, given us a 24-carat immunity. By that he means, in comparison to gold, is that the best immunity is natural immunity. And a large percentage of Indians have this natural immunity because they've already been afflicted, their bodies have fought it silently, and therefore, if the virus comes to them again, they're in a far better position to handle it. The second major reason is that there have been over 2 billion doses of COVID vaccines that have been administered across India. And if you add that up, close to 800 million people have either got the first dose or the second dose or even the third dose across the country. And this double immunity, as it's called, where you have the natural immunity on one side, you also have the immunity that the vaccines are producing, have made us far more resistant, far more stronger in terms of handling the recent Omicron virus. So what this means is that this double immunity that we have got has ensured that even if Omicron struck and it might have been quite venomous, its impact on us has been much, much milder. So we have dealt with the two major reasons, which is a natural immunity as well as a vaccine-induced immunity. And the third reason why Omicron virus seems milder is the fact that the virus itself is mutating. Now, this is a very, let's say, evolutionary sort of reason. The fact is that as it encounters more and more human bodies that are immune to it, that are able to tackle it, it begins to create its own variant, and the variant it has assumed allows it to afflict a lot more number of people, but may not cause the kind of extreme stress and disease and illnesses that it caused with the earlier variants. So its survival is dependent on the fact that if, for instance, it is very seriously afflicting a particular host, as it happened in Ebola, where the death rates, fatality rates were as much as 50%, the virus tends to die with the person or whoever's afflicted with it. So what viruses do is they start getting more broad-based. They seem to, that's what experts say, I'm simplifying things, that they begin to assume forms or mutate into forms where they can be easily transmitted and get more and more people afflicted and therefore survive. And that, many experts believe, is what Omicron is doing. It has more than 50 to 60 variants and it continues to mutate. That does not mean, and let us be very clear, that it is not a dangerous virus. The fact is, because of our immunity levels, it might be far more milder, but many experts say you need to watch out and don't take it that easy. So while there is caution among experts, many people believe that COVID virus, as we know it now, will become endemic in the sense it will be there in the atmosphere. We will get the infections that are there, but it will be more like the seasonal flu that we have, the colds and coughs that we get. It will be part of that. We would not have to fear the kind of extreme afflictions that had happened in the earlier waves. Again, it is a matter of caution. This is what some experts believe. And if they see the progression, or if you study the progression of the Spanish flu in 1918, it had 4 major waves, just as we have seen during the COVID phase this time. And by the end of 1920, it almost went away. But then it had its own variants. It appeared again as the swine flu and then the Russian flu before it lost its venom and became part of what we call the seasonal flus that exist. We continue to have the descendants of the Spanish flu with us, but they are in a much more milder form. They are seen as the common flu, and many vaccines have been developed, particularly in the US, to deal with such common flus. While COVID has taken much away from us, many of us have lost near and dear ones, it has also had some pluses. And among that is that it has made healthcare across India more accessible, affordable and available, as Dr. Devi Shetty, a top heart specialist, says. Moreover, from just one testing center when COVID struck us in March 2020, we today have 4,000 laboratories across the country that do RT-PCR tests and deliver results. And if you look at the number of laboratories that are tracking COVID, from 1 or 2 laboratories in the country when it began, we today have 56 biotech laboratories that is tracking every variant of COVID virus and making sure that we are aware of the dangers that is there. Let's also look at the vaccination program, where, as I mentioned earlier, over 2 billion doses had been delivered, and this is possibly one of the world's largest and most successful vaccination programs ever carried out. And all kudos and credit to the Modi government, the state government, all the virus manufacturers, and those that dispense with it. What we have today is something like 12,000 vaccination centers who at the peak was able to deliver as much as 10 million doses every day. We still have the vaccine capability, and apart from that, after the second wave struck us, the Delta wave, and given the fact that the Delta wave caused so much stress in terms of oxygen availability, the center established over 1,200 oxygen plants to ensure that we would never face a shortage again. Also, very importantly, we have many more vaccines than other countries do. In fact, the whole spectrum of vaccines, unlike China, which has so far relied only on a couple of vaccines against COVID. Dr. V.K. Paul says that all this makes us ready for any eventuality, whether it is the next wave, the next pandemic, or any outbreak of the disease. The good thing about the COVID pandemic in terms of health infrastructure is that it is far more resilient, it is alert, awake, and ready in case there is another wave or another pandemic strikes us. Much of the facilities or infrastructure that was established to tackle COVID is now being diverted, and rightly so, to other diseases that need it. For a while, the other diseases had to take a back seat, and now the same facilities are being used to treat tuberculosis, cancer, the new flus that have come out like tomato flu and others, and a watch is being kept, and this is good news. What isn't that good news is that despite the fact that we had such a major drive on vaccination, only a third of the people have taken the third dose, which means that a lot of people are vulnerable, and there are a lot of people who have still not taken the first or the second dose, which leaves a certain section of population vulnerable to COVID, and then that could cause its own variant. So it's important that those who have not taken their third dose or completed any of their doses, that they do so that they get immunity and the country also is protected in that sense. Of course, importantly, all those of us who have taken the third dose need not so far take the fourth one. The government is yet to announce it. And when I spoke to Dr. Paul, he said, so far there are no plans. We are on a wait and watch as to whether you need a fourth dose. So even as we are in a comfortable position and we seem far more relaxed than what we were 2 years ago, we need to worry about 2 or 3 other things that's there. The first is that the vulnerable population, particularly the elderly and those who have comorbidity, they have to be treated and they have to be monitored carefully, because as we know, in these cases, any attack, even a mild attack, could be devastating. And so we need to ensure a protocol that is there in terms of anti-inflammatory and other kinds of drugs that are available to treat them, and create a kind of a standard way of handling that, because that is going to continue to happen. The second is we need to pay attention to what is called long COVID. Many of us had those symptoms that even much after we recovered from COVID, we suffered from insomnia, we had body aches, there were psychological problems, you had lung infections, even heart diseases that seemed to persist, and doctors say that is part of the problem of having COVID. So again here, you need to keep a watch on these people, you need to have a sufficient protocol to treat them, and we must be constantly innovating and updating our knowledge on how to handle long COVID. So while we may have won the initial battle against COVID, the war against the virus is just not over. If you look at our health infrastructure, particularly in rural areas, and if you see the ratio of bed to population, which is a good indicator of how good your health facilities are, in India, it's 0.5 beds to 1,000 population. And in some districts, it can be as low as 0.26 beds per 1,000 population. What the World Health Organization mandates for a good health care facility is close to 5 beds per 1,000. We are far, far below that, and we need to develop our health infrastructure to meet other eventualities that may happen beyond COVID. Apart from that, we also have an ongoing shortage of rural doctors, and one estimate says that there is a 76% shortage of specialists in various villages across the country. Now, these are serious issues that both the center and the state government have to address in terms of our health preparedness and infrastructure. And this can be tackled even as we face a lull in COVID cases. To sum up, let's hope that another storm of COVID doesn't break out, and even if it does, we are prepared to handle it. Thank you for listening to this episode of Nothing But the Truth. I look forward to having you with me the next time. Nothing but the truth.